Okay. Welcome. This is the presentation on visual and visual perception interventions for people with TBIs. I'm Madison. This is Megan, Melissa, and Danielle. And our question was, what is the evidence of interventions OTs could use to address visual and visual perception issues for people with TBIs? So a little bit of background information. In vocational rehabilitation facilities, there are limited interventions to help patients who have visual impairments after a TBI. So there are common devices that are used. These can include magnifying glasses, easels, light devices, but there's little research actually done on other helpful interventions to help increase and support independence in a variety of occupations.
So for our methods, we had 8 peer-reviewed articles that we researched to find the evidence of visual and visual perception interventions for those with TBIs. We used key terms such as vision, visual impairments, intervention, TBI, and rehabilitation. And we used databases such as CINAHL, PubMed, and AJOT. Our inclusion criteria could include traumatic brain injury participants, visual impairment interventions, and could include active motor dysfunction. And our exclusion criteria could include articles with visual interventions that were not specific to a TBI. And then we also had some limitations. So our research was completed as part of an assignment for class. We were limited to 8 research articles. There was little evidence supporting interventions to address visual and visual perception issues for those with the TBI. All of the articles contained small sample sizes, and we focused only on interventions within our research.
So here we have a picture of the pyramid. This is Mary Warren's hierarchy model for evaluating and treating visual perceptual dysfunction in adults with acquired brain injury. A lot of people have probably seen this before, but basically visual perceptual skills come from a hierarchy of skill levels that interact with each other. So higher level skills are formed from lower level skills, and this model uses the idea of that bottom up approach. So bottom level skills form the foundation of the higher level skills, and that's what the pyramid is for. And then when a brain injury disrupts the integration of these skills, if the lower level skills are affected, the higher level skills will be affected as well. So by using this approach with clients, we can perform this evidence-based practice that best supports our clients' success.
Okay, so now we're going to jump down to some of the results we found for interventions. So our first one was ocular motor training. The article represented 2 different protocols. It was a pilot study. So we have the 6 eye exercises protocol, which is your bottom-up kind of model, and it uses eye stretches, tracking, gaze, stabilization, spatial location, saccades, and vergence to strengthen the eyes. And then the standard of care is a top-down model, and it usually just focuses on eye-heavy activities such as reading. This pilot study found that both models are capable of producing positive results. They kind of have their individual strengths and weaknesses. But yeah, it proves that they work pretty well.
Then we have prism glasses, which will help an individual enhance their awareness of their impaired visual field, by which they're going to shift an image from a non-seen area into a seen area. And this is typically used with people who have hemianopsia.
And then the last one we have is binocular occlusion. So in the article, we found that the effect of binocular occlusion on the visually evoked potential, which is known as the measurement of electrical activity in the visual system. Basically, in this article, the results showed that binocular occlusion increased VEP in participants with mild TBI. And then binocular occlusion is showed in the image of the guy wearing glasses.
And then we're going to talk about the clinical implications of our research. So implications showed that there was limited research to afford clinicians confidence in their treatment plan. Evidence-based practice is very important. So without this, clinicians will not be able to provide advanced interventions around visual and visual perception issues for people who have TBIs.
And okay, so for future research, we found that There is a little bit of evidence to support interventions with visual issues, but it's a really limited amount. So we noted that there needs to be a lot of research in the future on this topic to be able to support OT practitioners in creating evidence-based interventions and just having an overall good treatment plan.
Okay, thank you.
Yeah.
Thank you.